Good afternoon, everybody. I appreciate everybody taking time out of their busy afternoons to join me for this webinar this afternoon that will discuss the value that you can provide to your clients with Medicare. Some of you who are joining the call are experienced advisors, and this presentation will provide an overview of Medicare and provide some needed updates for all advisors who are at different various points of their career. For those that are joining us that are new to Medicare, I appreciate it. And this presentation will discuss a lot of the value that we provide for advisors in the Medicare space and provide an overview of some of the updates that people can expect from Medicare going into 2025. With regards to this presentation, we'll discuss the need and how important it is right now for independent insurance advisors to be speaking to their clients about Medicare. We'll discuss the options that are available and persistency and why persistency is so important. And adding Medicare can really increase the persistency that you have amongst your block of business and the value that you provide to your clients. I'll certainly discuss the revenue that you can earn and the revenue that you can generate from Medicare sales, and a special emphasis on the resources that I provide for Medicare advisors with regards to our two different distinct models, sales models, both our brokerage model and our direct sales model. And excited to announce in this presentation the Jumpstart bonus that will kick off the new year for Medicare advisors. And certainly there's an opportunity for questions and answers during the presentation. And if you have a question, please be sure to type it into the chat feature there on the Zoom chat, and I'll address the questions and answers at the conclusion. And if there's pertinent questions, I'll be sure to address those throughout the presentation as well. Currently, there's 10,000 baby boomers turning 65 every day in our country, with some estimates now showing that that number's up to 12,000 per day. Many of these consumers, Medicare beneficiaries, are unsure of who to ask or where to go to ask for help or guidance on their Medicare. And many of these people may be your clients. If you speak to them about health insurance or life insurance or your help with their financial planning, they need to know that you can speak to them about Medicare as well and help guide them on these important decisions. The cost of Medicare and healthcare in retirement is just staggering. It's the 2024 report from Fidelity indicates that the cost of healthcare for a retired couple in 2024 is $330,000. This number to consist of Medicare's out-of-pocket cost for co-payments, co-insurance, and deductibles for doctors and hospital visits, the Medicare Part B and Part D premiums, and the cost of prescription drugs for generic, brand name drugs, and specialty drugs. This Fidelity study went on to say that 55% of Medicare consumers say it's going to be difficult to enroll in Medicare coverage, and half of them expect to feel overwhelmed or confused when selecting their plan. The Fidelity research finds that the average American estimates that the cost for healthcare expenses will be just $75,000 in their retirement years, which is half of the cost of Fidelity's calculations. In 2024, and we just completed the Medicare annual enrollment period, this past year indicated that there was 43, on average, 43 different Medicare Advantage plans consumers could choose from, which is the same amount as in 2023, but an increase from prior years. And helping consumers determine which of these 43 different plans and I just want to reiterate again, if anybody does have any questions, feel free to type those into the chat feature, and I'll be sure to address those. Now, when you're talking to your clients about the staggering costs of Medicare that we have detailed on the previous slides, it's important to know that they can curtail these costs either through a Medicare supplement or a Medicare Advantage plan. A Medicare supplement plan pays for the coinsurances and deductibles that were detailed on the previous slides. And they have, for Medicare supplement plans, you have to pay a monthly premium, but typically you have little to no out-of-pocket expenses with a Medicare supplement plan. With a Medicare supplement plan, you have the freedom to choose any doctor that you want anywhere in the country, as long as that provider takes Medicare, which 99% of medical providers are accepting Medicare. And there's no referrals necessary for those who are on a Medicare supplement plan. Medicare supplement plans, some routine services are not covered, like dental or vision or hearing coverage, but those can be purchased through separate standalone policies. Though some Medi carriers do offer value-added benefits for like vision discounts or dental discounts as part of their overall wellness package that they provide as a value-added package for Medicare supplement plans, depending on the carrier. And Medicare supplement plans, again, are covered anywhere in the U.S. that for any doctors that take Medicare. With regards to selling Medicare supplement plans, no certification is needed. All is needed is a health license, a state appointment, and be contracted with the carriers. And commissions for Medicare supplement plans are a percentage that level commission, and commissions are vested. And we'll discuss commissions more specifically coming up. As for Medicare Advantage plans and comparing that to a Medicare supplement plan, Medicare Advantage plans are HMO or PPO or even special needs plans for those who may be dual eligible for Medicare and Medicaid. Special needs plans can also be for the chronically ill. And there's also private fee-for-service plans that are more common in rural communities where there aren't a lot of networks established. With Medicare Advantage plans, you pay zero to little premium per month, but in exchange, you have higher out-of-pocket expenses that can be capped anywhere from $4,900 up to $7,900, depending on the carrier and the county in which one resides. Medicare Advantage plans really focus on whole person healthcare and wellness, not just healthcare, but overall wellness picture, and can include additional benefits that are not covered by Medicare, like dental, vision, hearing, fitness facilities, and overall, again, fitting the overall health of the individual. With Medicare Advantage plans, with an HMO or a PPO plan, you're can be restricted to a network, with an HMO plan being restricted to the network that you have to use in-network providers. But with a PPO plan, you have the option of using both in and out-of-network providers. If you were to use an out-of-network provider on a PPO plan, you would just pay a higher copay. Again, that would be capped. The out-of-pocket, maximum out-of-pocket would have an in-network out-of-pocket expense cap, and as well as an out-of-network. And with Medicare Advantage plans, you can get emergency services as well, even if you're outside of that service area. In order to sell Medicare Advantage plans, in addition to being licensed, appointed, and within the state and contracted with the carriers, you have to pass an annual certification with each carrier. And with Medicare Advantage plans, commissions can be higher and payable for life of the policy. With Medicare Advantage plans, we're looking at $626 commission for a initial year Medicare Advantage sale for one who is enrolling into a Medicare Advantage plan for the first time. If one is replacing a Medicare Advantage plan, going from one carrier to another, those cases pay $313 in 2025. And again, the renewals pay $313 as well. And those renewals are payable for the life of the policy, as clarified in the beginning of the year. Medicare sales and offering your clients Medicare Advantage or Medicare supplement coverage can be very lucrative and help you build revenue for your company or yourself as an individual. With regards to Medicare supplement plans, we see commissions payable from Globe Life here in New York State being 16% level for life of the policy. In other states, commissions are 22% level commission for years 1 through 6, and they pay a small trail of 5% years 7 through 10. And the main revenue generator for Medicare supplements is renewal income. So when you sell, it's in an example where you were to sell, say, one policy a week, you sell 52 policies a year. That's about $15,000 to $18,000 in added revenue that you could earn. And then in the renewal years, you're going to earn that same amount. You're going to get paid your renewal commission on the business you wrote the previous year. And if you were to sell the same amount, you'd earn that another 18,000 roughly in that second year. So $36,000 total in year 2 and onwards and upwards. So an illustration shows that after 6 years, 5 to 6 years, advisors just selling one policy a week are earning over $100,000 in just Medicare sales, in addition to the revenue that they're generating from their other lines of business. As for Medicare Advantage, a first-year Medicare Advantage sale, that's when someone is enrolling into a Medicare Advantage plan for the very first time, those pay $626. If one is replacing a Medicare Advantage plan, going from one carrier to another carrier, those cases pay $313. And again, in renewals, $313 in renewals as well. And in order to earn those renewals, advisors must be certified each year to continue to earn the renewal income that's due to them. Throughout my career, I've really seen a lot of value for advisors who have taken on Medicare. It really helps them with the persistency amongst their block of business. And it really helps provide value to the client relationships. Selling just one, if you just sell one policy to your client, you kind of risk losing that client. It doesn't really connect the client to you and to the value that you can provide. But if you become a one-stop shop for all their life and health insurance needs, you're really increasing the persistency of your book of business. And with each policy you sell, dramatically increases your client persistency and puts more money in your pocket. According to the Database Marketing Institute that talked about a study that was done about persistency, shows that the more policies one sells, the higher the persistency and is maintained. So if those who are selling 5 or more policies to their client really are seeing a close to 90% persistency rate amongst their clients who are retaining that business for many years to come with those specific clients who they are selling multiple policies to. Medicare is all about a trust sale. It's really important for advisors to build upon the trust that you have already established with your clients. So whether you've sold your clients a life insurance policy, a homeowner's policy, it's important to keep in mind that they or their loved ones will have questions about Medicare. And as studies have indicated, seniors are really clamoring for guidance on Medicare choices. So be sure to offer guidance on the best options that are available to them. It's important to know that you don't need to be the expert with regards to Medicare. You just need to know some of these basics that are discussed in this presentation and know that you can contact me for the more complex questions that may come about from your clients and consumers that you're working with. It's important when speaking to your clients and marketing Medicare that you don't just focus on the people who are turning 65. The 40-year-old clients that you're talking to about helping build their wealth will have loved ones, their parents, family members, and who are needing Medicare advice. And those people that you are offering guidance to about helping build their wealth, that you've built that trustworthy relationship with them, they're going to want to be able to tell their loved ones about the excellent relationship that they have and the service that you provide, and tell them to come to you for their Medicare needs as well. To help with starting the conversation amongst your clients for Medicare, you can ask additional questions about, if they need dental care, or are your final expenses taken care of so not to burden your loved ones? Or what happens if you get cancer? Or are you insured in the event that you would be confined to a facility? These are very important coverage benefits that are needed in the senior community, and that sometimes Medicare does not cover. And you can rely on KAFL and our team at KAFL to talk to you about final expense insurance or dental coverage or a standalone cancer policy or even long-term care. These are important needs in the senior community. And again, asking these questions can help build that value that you have with your clients and help you make more sales and revenue for you and your company. KAFL has a very proud tradition of being committed to helping advisors provide peace of mind to their clients. So we work to provide peace of mind to insurance professionals nationwide with proven Medicare sales models to best fit your business. Our market expertise, powered with the industry's premier technology, provides advisors the need, provides you with a powerful partner that you need to provide value to your clients. And with that, we have two distinct models for Medicare that we can offer to advisors: our brokerage model and our direct model. So with regards to the brokerage model that I am mostly responsible for, we provide a lot of different services that I will discuss in the next coming slides that help you become the valued Medicare resource to your clients and those in the community. With regards to our direct model, my colleague Todd manages that. And for advisors who know the value of Medicare, know that it's an important part, but may not want to dedicate resources to it, you can refer clients to my colleague who can help you help your clients choosing the plan that's going to best meet their needs. To reiterate, we are committed to being your main source for all things Medicare, to help you provide more value to your client and your client relationships and help you make more money. With some of the specific value that we provide Medicare advisors, we have excellent lead generating platforms to help you gain new clients. LeadStar Marketplace is one of the premier Medicare lead platforms available that can connect you directly with Medicare beneficiaries in your own community. Medicare Express is an excellent tool that sets preset appointments for advisors in the specific zip codes that you choose to market in. So these are preset appointments, and these leads cost anywhere from $50 to $100. But with regards to our KAFL Cash Marketing Reimbursement Program, our KAFL Cash Marketing Reimbursement Program can reimburse you the costs of any marketing expenses that you incur when you have 12 issued cases. So for every 12 issued cases, we can provide you with up to $500 in Medicare marketing reimbursement. Again, we provide contracting with most major carriers. For Medicare supplement, we're excited to be able to provide opportunities with Mutual of Omaha, Globe Life, which is United American and other states, Aetna, Cigna, Allstate, Anthem, Humana, and AARP from United Healthcare. With regards to Medicare Advantage, have a very diverse portfolio of both regional and national carriers. Our regional carriers in Western New York to be Excelis or Univera, Highmark, CDPHP, and we also have regional carriers in Michigan for Blue Cross Blue Shield in Michigan and Priority Health. And for your clients that are in Florida, maybe have moved to Florida during the winter, or you may have clients that have moved there permanently, we have options in Florida as well for your clients in those situations, and certainly want to be open to other carriers that may be of benefit to you. So please be sure to let me know, and I'd be gladly look into those options. We have an excellent team here to provide you with compliance and helping you navigate the difficult compliance requirements that are mandated from CMS in this industry. As being a AmeriLife affiliated agency, we are excited to be able to rely on the expert knowledge and compliance and providing you with very quick, easy turnaround and helping you with getting stuff approved, like marketing pieces approved, and getting those approved with specific codes that so that when you're using those materials that you've established and developed, those codes can indicate that they are compliantly approved with regards to we're excited to be able to rely on the team that we have with AmeriLife to be able to provide you with those quick turnarounds on compliance marketing materials. Some of the most important tools in the Medicare space are with regards to providing quoting and enrollment platforms. We are excited to be able to have available to our producers Sunfire. Sunfire is our Medicare quoting, comparison, and enrollment platform and allows advisors to quote and compare all of the carriers that are available in a given area. And you can submit enrollments with those carriers with the national carriers, United Healthcare, Humana, Cigna, Aetna, WellCare, amongst others as well. And I'm going to be able to show you a quick demonstration, a quick video here that kind of gives you a quick overview of Sunfire.
What if you could serve more clients more efficiently and more effectively? What if you could scale your business across new geographical areas, opening doors you never thought possible? What if you could spend less time filling out forms and more time helping your clients find the coverage they need? What if you could do all that while staying compliant and protecting your clients' data? Welcome to Sunfire, the smarter, simpler Medicare solution. With just a zip code, you can quickly see the plans you're ready to sell in the area, including Medicare Advantage, Medicare Supplement, dental vision hearing products, and more. You can understand each client's unique situation with a snap of your fingers, taking into account their medications, doctors, and coverage preferences. You can even verify the client's Medicare number, Part A and B effective dates, LIS status, and more. Sunfire will then help you compare plans at a glance with our intuitive, easy-to-use quoting tool. Comparisons include accurate cost estimates you can trust, using data delivered directly from the carriers. Once you've selected a plan, help your client apply with our streamlined enrollment tool that includes compliant voice, text, email, and in-person signature options. Or you can send them a link to your Pearl where they can self-enroll. Once the enrollment's completed, seamlessly move directly into the health risk assessment where available to ensure the client's set up for success on their new plan. Finally, you can securely save client information so you can be their advocate for the long haul. There's so much more to explore on Sunfire, and we can't wait for you to try it out. Contact your upline today to learn more about how you can work smarter using Sunfire.
So that's Sunfire, and the power that that provides to advisors really helps simplify the business and helping you with providing accurate comparisons to your clients of all the plans that are available in the area and doing enrollments. It's a very slick tool. That's just a very a brief overview of Sunfire, and I'm glad to provide other trainings on that as well to show advisors all of the different ways it can enhance your business. We also have an instant quoting tool that's powered by CSG through, and we have access to that through Agent Accelerator. With our instant quote tool, it provides you the options to provide instant quotes for Medicare supplements, Medicare Advantage plans, prescription drugs, dental plans as well. And I'll show you a brief demonstration of that as well that I can provide you with. So all of these tools are available on KAFL's website, kafl.com/Medicare. And once you're on that site, you'll be able to see links to these sites that I have linked to directly here in this presentation. So once you're in this tool through Agent Accelerator, you'll be able to log in. All you need to do to log in is to have an NPN number. And then once you're logged in, you'll be able to go to Sales Management and click on the CSG Quotes and Tools. This tool allows for instant quotes for just to get a quick snapshot of what's available in particular zip codes. So with regards to, let's say, Medicare Advantage plans, you could just do a quick quote. Customize it with your client's name. So let's take a little bit to load. Time that I like. And again, this is just a quick quote, quick comparison. You're not entering any prescription drugs in here, or you're not indicating any physicians. It's just telling you what's available, and it gives you a summary of benefits and outline of benefits as well. So like you can compare different carriers. United Health, we can just, for the purposes of this demonstration, we'll compare this United Healthcare plan, an MVP plan, and an Excelis plan. You want to make sure you click on the show additional details so that it shows all of the plan, all of the benefits available. And in this comparison, you can compare up to 5 plans at one time. And that provides you an excellent presentation to your clients to show you your client, a comparison of these carriers. Again, for just bare bones, not any prescription drugs, you're going to want to use the Sunfire tool for the more accurate quote. And then for this, you can print it to a PDF and provide your clients with a nice polished presentation. I really like this tool. I use it throughout my career for Medicare supplement quoting. To provide a Medicare supplement quote where you're going to want to provide your client with just a premium, and with Medicare supplement plans not covering prescription drugs, you don't, and them being open network, you don't have any doctors. This is the best tool to use for a simple Medicare supplement quote. So I'll use Cleveland, Ohio, for a 65-year-old female, a Plan G. And again, it'll take a few seconds to load. But here you show all of the carriers that are available. Again, here at KAFL, we are appointed and can, with the most competitive options, Mutual Omaha, Cigna, Aetna. We can get Medico if needed. And again, you can compare up to 5 different plans at one time. And it will show you what the premiums are, and also with regards to if they have a discount or not. So most of these carriers have discounts, either anywhere from 7 to 12%, depending on the carrier. And again, an excellent way for you to show your client, to be transparent with regards to what the most affordable options will be for them to enroll in a Medicare supplement plan in this regard. And just a reminder too that you can also use this tool to quote for final expense, dental plans, and hospital indemnity. Now I'm very excited to share with you some exciting news to debut our Medicare Supplement Jumpstart Bonus. To kick off the new year, we're excited to announce that we'll have a specific bonus applicable for Mutual of Omaha and Globe Life or United American Medicare supplement sales. So you get appointed and issue 1 case in the first quarter with these carriers, either of these carriers, you'll earn a $50 bonus. If you were to issue 10 policies by the end of the second quarter in 2025, we'll provide you with a $500 bonus. This is in addition to the commissions that you would earn with these carriers as well. We find it very important to making sure that advisors are incorporating other lines of business other than just the Medicare Advantage or the Medicare Supplement into their portfolio. I understand that with Medicare supplement plans being more costly in New York State because it's a guaranteed issue state, that Medicare supplement a monthly premium of roughly $290, $300 a month or more for a Medicare supplement premium can seem costly, but with a lot of the regulations and a lot of the changes in the Medicare Advantage market that we experience as AEP, it's really important to diversify your portfolio and offering both Medicare supplement and Medicare Advantage plans as options for your clients. So now the presentation concludes, just want to reemphasize that, you need to determine the best business model that works for you, and we can help you determine that. I invite you to visit our Medicare resource page, kafl.com/Medicare. That will highlight a lot of the resources that were discussed in this presentation and provide you with resources like the Medicare and You Guide and other important documents that can answer other important questions with regards to Medicare. You can, help you. I specialize in helping you with carrier selection to determine which carriers that you need to offer to your clients. And of course, with contracting and certification. Throughout my 17 years in the business, I've developed a lot of different strategies to help advisors be able to digest all of the certification requirements and helping you easily complete it and making it not seem as cumbersome and as difficult a task to manage. And I really specialize in developing and helping advisors execute marketing plans. We have various tools, like I mentioned, with our lead generating platforms that you can implement to help you generate new business, and helping you also implement the resources that we provide with the enrollment tools and quoting capabilities as well. So I really want to open it up for questions. If anybody does have any questions, please feel free to type those into the chat box, and I'll be glad to answer those questions. So if you have any questions, please let me know. One other thing I want to point out is that I just, prior to this presentation, I attended a webinar that was offered today by NABIP, which is the National Association of Benefit Insurance Professionals, formerly NAHU. And I was thrilled to hear of all the advocacy that they're doing on behalf of independent agents with regards to some of the carrier actions that terminated, paying commissions on certain plans throughout the country. And, they're really advocating for agent rights to be sure that, agents are fairly compensated for the work that we're doing, because again, the value of a Medicare advisor is so critical, so important in our communities and in our business right now. And again, I'm here to making your business easier and advocating for you as well with regards to the industry. And we are appointed in all 50 states, so we can help you out with licensing in any state that you are licensed in. And the services that we provide, these value-added services, the enrollment platforms, the quoting tools, there's no cost to use those to our advisors. There is cost for the lead platforms, but again, we do reimburse that and provide reimbursement back upon issued business. And I'll be sure to share more of those details through our emails and our newsletters that we put out on a monthly basis. But very excited to continue to provide value to you and throughout in the new year with all of our Medicare carriers and helping you enhance your business in this marketplace. So I hope everybody has a wonderful, happy holiday season and Merry Christmas. And again, feel free to reach out to me at medicare@kafl.com or my email that you see there on your screen, or you can give me a call at 585-440-2920. Again, thank you all for attending this afternoon, and have a great rest of your day.